saying, when did your symptoms start? That rash.
I've been having this like off and on for years.
Like, can you imagine how many years? Or can
like,
you?
At least, I would say like 5 and more.
5 and more years. And then you, last week, you said it was so painful. Why did you even ask me for help?
Because I asked my primary care, like, and it was for this side, and then like he gave me antibiotic, he got rid of this side, and then it appears on this side. So that's why I was like, would you know anything about this? Yeah.
And what antibiotic he gave?
I forgot. I have the bottle at home.
And it was a 5-day supply?
It was 10 days. One a day for 10 days. No, it was 2 pills a day for 10 days. 20 pills.
20 pills.
Yeah.
So antibiotic is
actually... It was, I think, amoxicillin.
Yeah. Okay, antibiotic is a wrong treatment, by the way. I mean, I'm not picking on anybody.
No,
because
I trust
think
you after
because what happens is we get so much antibiotic from animal supply anyway. You don't need any more antibiotics. Seriously, what we need is always think of it. We are rotten food inside and we are mold. Okay, that's all. We are building mold everywhere. That's what black mold is everywhere. But the problem was when you said to me that you had problem on one side and it shifted to the other side, the only thing I could think of was shingles. So I was telling you, right, it could be shingles. And then I decided to take a look, and it was not shingles. It was just skin rash because you had abnormal flora. So like, let's see, our skin is filled with different organisms because our skin feeds these organisms. We live with antimicrobials, microbials, fungus, bacteria. We are host for them.
Right.
And these are our friends. They clean our body, so to speak. But if you feed the right one, they are friends. If you feed the wrong one, they are enemies. So when you get pain, it means something is wrong, right? So the bad ones are taking over. So when I looked at it, it was fungus. So that's why I gave you antifungal. Next time, if it ever happens, you just go get the athletic foot spray and just spray. Did you do that?
That's it.
That's all. You don't even need orally. But because you had that loaded of antibiotics, so that's why I gave you orally. And it usually reduces the pain and stuff. Because you were having pain, that's why I treated it internally.
Very painful.
What would be the scale number?
It was, probably like an 8. It hurt, but not like where I'm going to scream.
Where it was getting to a plot. You were worried about cellulitis. So you're kind of thinking it will become like internal. And that's why you asked for help, right? Yeah. So I sent you antifungal. So explain to me how long it takes for you to not have the pain.
From when you gave me that medicine, probably like 4 days.
So you did have pain for 4 days?
For like a few days, but it kept going down and down.
So the first dose, how much did the scale come down? You said like 8, 9, right?
Probably down to 7.
And then so it became severe to moderate, and then mild.
And then it kept going down 6.
So you could see a steady improvement, and you were doing 2 a day.
No, 1 a day.
Oh, so, okay, that's fine. 1 a day or 2 a day, it doesn't matter. But the thing is, only 3. So. Yeah, only 3 days you need to take. So how many days did you take?
Oh, really?
I give you extra so that you will have.
I have 2 left. So should I just take both today?
No. Keep it for backup. Because the reason it is only 1 or 2 a day for the 3 days is that's how long it takes for the liver enzymes to paralyze. Okay, even cholesterol medication is the same way. Once you paralyze it, for 7 days you don't need the medicine. Think of it. So it's a once a week supply. Gotcha. So if it ever comes back, you would take it once for 7 days you wait.
Yeah.
So the second dose would be after 7 days, but you wouldn't even need it. But this is like, if in case it ever reoccurs, you kind of are feeding wrong. So you might have to think about your diet. What is it that makes it come back?
Right.
So because what happens is indirectly when you poop, you wipe there. And that's what is smearing and causing the rash to come back. So it's coming from belly, not from outside. If you understand that concept, you would adjust it better. You understand? Okay.
All right.